What if the medications you trust every day are quietly damaging your heart without you even knowing? Today, we reveal the hidden dangers behind the most common drugs and how to protect yourself before it's too late. I'm about to expose something that may genuinely disturb you, something that could already be sitting in your bathroom cabinet right now, quietly damaging the most vital organ in your body. After more than 20 years as a cardiac surgeon, I've witnessed seemingly healthy individuals walk into my operating room with hearts severely compromised, not by illness, but by medications they trusted without question. These aren't rare prescriptions or experimental drugs. I'm talking about the painkiller you used this morning, the stomach tablet you took with breakfast, even the cold remedy you grabbed last week without hesitation. What I'm about to reveal directly challenges everything you've been led to believe about these safe medications. Pharmaceutical companies would prefer this information stays hidden. Many doctors don't mention it, not out of negligence, but because they're unaware of the full extent of the damage. But I've seen the reality firsthand, case after case, heart after heart, and I can't ignore it any longer. By the end of this video, you'll know exactly which 5 medications are silently weakening your heart muscle, why the risk becomes far greater after age 60, and most importantly, what immediate steps you can take to protect yourself. This isn't fear-driven exaggeration. This is critical, life-saving awareness. Stay with me, because what you're about to discover could literally extend your life. Let's begin with the medications found in nearly every household. The non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. You recognize them as ibuprofen, naproxen, and diclofenac. They're the quick fix for headaches, back pain, arthritis, and everyday discomfort. And yes, they are effective, remarkably so. But here's the truth rarely discussed. Using these drugs regularly after the age of 60, especially if you have any underlying heart concerns, is like taking a dangerous gamble with your cardiovascular health. The medical field has been aware of this hidden risk for years. As far back as 2005, the FDA required clear warnings about increased risks of heart attack and stroke on these medications. Yet millions of people continue to take them daily as casually as candy, completely unaware of the serious danger with every dose. Let me tell you about Michael, a 72-year-old patient who found joy in gardening. He suffered from chronic knee arthritis and relied on these pills almost every day to manage his pain. One afternoon, while working among his rose bushes, he suddenly felt overwhelming fatigue. He struggled to breathe and his ankles became severely swollen. By the time he reached the emergency room, he was in acute heart failure. His heart, already under strain from age and mild hypertension, had reached its limit. The cause wasn't a new heart disease. It was the prolonged use of that seemingly harmless anti-inflammatory medication. So how can something so common turn so dangerous? The answer lies in its subtle but destructive mechanism. NSAIDs reduce inflammation by blocking specific enzymes, but in the process, they also disrupt critical substances that protect your kidneys and blood vessels, setting the stage for serious cardiovascular damage. This triggers 2 highly dangerous and often overlooked consequences. First, these drugs force your body to retain excess salt and water. Think of your heart as a pump. When the volume of fluid in your system suddenly increases, that pump is pushed to operate under intense pressure. A younger, resilient heart might tolerate this burden, but a heart already strained by aging, stiffness, or high blood pressure can quickly reach a breaking point. Second, NSAIDs can tighten your blood vessels and drive your blood pressure upward. Even if you've never struggled with hypertension, consistent use can elevate your levels significantly. And if you're already on blood pressure medication, NSAIDs can completely undermine their effectiveness, allowing your pressure to surge dangerously high without any obvious warning signs. It's crucial to recognize that the level of risk depends heavily on dosage and duration. Medications like diclofenac and high-dose ibuprofen, around 2,400 milligrams per day, are strongly linked to cardiovascular complications. Lower dose naproxen may appear somewhat safer, but the risk is never completely eliminated. And here's another alarming reality. If you rely on low-dose aspirin to protect your heart, certain NSAIDs like ibuprofen can actually block that protective benefit entirely. So what's the right approach? The answer isn't to endure pain in silence. It's to make informed decisions. Have a direct and honest discussion with your doctor. Ask clearly, given my health history, what is the safest option for managing my pain? There are alternatives available. In some cases, acetaminophen may be enough. In others, topical anti-inflammatory creams or gels that target pain locally can be highly effective. And if an NSAID is truly necessary, the guiding principle is simple. Use the lowest effective dose for the shortest possible time. Now we come to number 4, and this one will genuinely catch you off guard because it's widely promoted as a protective medication. We're talking about proton pump inhibitors, or PPIs. Drugs like omeprazole, pantoprazole, and lansoprazole are among the most commonly prescribed medications worldwide. Millions of people take them daily as part of their routine to control acid reflux, or to shield their stomach from other medications like the NSAIDs we just discussed. But here's the harsh irony. The very drug meant to protect you may be quietly introducing a completely different risk behind the scenes. Consider the case of Helen, a 68-year-old patient who was prescribed omeprazole for chronic acid reflux. She was advised to continue it indefinitely. Her symptoms disappeared, and she never questioned the treatment again. Years later, during a routine checkup, her electrocardiogram revealed an abnormality. Further testing uncovered the root cause. Her magnesium levels had dropped to dangerously low levels. Magnesium plays a critical role in maintaining your heart's electrical stability. Without it, the heart becomes erratic and unstable, like an orchestra without a conductor, increasing the risk of serious arrhythmias. The culprit behind Helen's deficiency was long-term omeprazole use. PPIs work by suppressing stomach acid, but that acid is essential for absorbing key nutrients. When it's reduced over extended periods, magnesium absorption is severely impaired. And the concerns don't end there. Even more troubling, multiple observational studies have identified a link between long-term PPI use and an increased risk of heart attacks. One possible explanation is that these medications may lower nitric oxide levels, a vital molecule that keeps blood vessels relaxed and flexible. When nitric oxide is reduced, blood vessels stiffen, creating conditions that can lead to a cardiac event. While a direct cause and effect relationship is still under investigation, the association is too significant to ignore. Additionally, omeprazole can interfere with critical medications, such as clopidogrel, an antiplatelet drug prescribed after heart attacks. This interaction can reduce the drug's effectiveness, leaving patients at greater risk. The deeper issue is that these medications have become normalized to the point of overuse. They were originally intended for short-term therapy, typically 4 to 8 weeks, but are now often taken indefinitely for conditions that could, in many cases, be improved through lifestyle changes. Have an open and direct conversation with your doctor. Ask clearly, do I truly need this medication long-term? Can the dosage be reduced? Are there safer alternatives available? And if long-term use is unavoidable, it becomes absolutely critical that your physician regularly monitors your magnesium levels. Before we move on to the next category of medications, including some commonly used for simple colds, I want to make a brief but important request. If what you've learned so far has been helpful, I'm asking for 2 simple actions. First, subscribe to this channel. My mission is to deliver honest, no-nonsense health information so you can make informed, life-protecting decisions. Second, and even more importantly, share this video. Think about your parents, your grandparents, your close friends. One simple click could spark a conversation that truly saves a life. Thank you for your support. Now let's move forward to number 3, something almost everyone keeps at home. We've reached number 3, oral decongestants used for colds and flu, specifically those containing pseudoephedrine or phenylephrine. These are often seen as the quick fix for a stubborn blocked nose that refuses to clear. But that quick relief can come at a serious cost to your heart, especially if you already have high blood pressure or any underlying cardiovascular condition. Take Margaret, a 75-year-old retired teacher who came down with a severe cold. Hoping to breathe easier, she purchased a popular cold medication containing pseudoephedrine. By the second day, she felt as if her heart was pounding out of her chest. She experienced intense dizziness and a crushing headache. Her son rushed her to the hospital, where doctors found her blood pressure had skyrocketed and she had developed a dangerous arrhythmia. That seemingly harmless decongestant had pushed her to a critical state. So why does this happen? Pseudoephedrine and phenylephrine are powerful vasoconstrictors. Their function is to tighten blood vessels. In the nasal passages, this reduces swelling and allows easier breathing. But these drugs don't stay confined to your nose. They circulate throughout your entire body, narrowing blood vessels everywhere they go. This leads to 2 serious consequences. First, as your arteries constrict, your heart is forced to pump against significantly higher resistance. It's like trying to force water through a tightly pinched hose. The pressure builds rapidly and dangerously. This can trigger a sudden and severe spike in blood pressure. Second, these substances act as stimulants, causing your heart to beat faster and sometimes irregularly. If your heart is already vulnerable, this added stress can push it into instability. In recent years, European health authorities have raised renewed concerns about pseudoephedrine due to its association with rare but serious conditions involving reduced blood flow in the brain. This highlights just how powerful and widespread its effects are within the body. The biggest danger is accessibility. These medications are available over the counter, leading many people to use them without fully understanding the risks. Labels are often ignored, and the potential consequences are underestimated. If you are over 60, especially if you have high blood pressure or any heart-related condition, it's safest to avoid these drugs altogether. Fortunately, there are safer alternatives available, such as saline nasal sprays, humidifiers, or corticosteroid nasal sprays that act locally without affecting the entire body. Never allow temporary relief for your nose to turn into a serious emergency for your heart. Now we move to number 2, a sensitive yet critically important topic, mental health. We're talking about an older class of antidepressants that are still prescribed in some cases for depression, and in other situations for managing chronic pain. These are tricyclic antidepressants, medications such as amitriptyline and imipramine. It's important to understand that depression itself is a significant risk factor for heart disease, which makes proper treatment absolutely essential. However, the way we treat it matters profoundly, and these particular medications can pose serious risks to an aging heart. Consider a 78-year-old man suffering from severe nerve pain in his feet due to diabetes. His doctor prescribed a low dose of amitriptyline. While it helped relieve his pain, he began experiencing intense dizziness every time he stood up. One day he lost consciousness, fell, and fractured his hip. The underlying cause was the medication, which triggered a sudden drop in blood pressure upon standing, a condition known as orthostatic hypotension. But that's only part of the danger. These drugs can also increase your resting heart rate, placing continuous strain on an already vulnerable heart. Even more concerning, they can disrupt the heart's electrical conduction system, slowing down the signals that regulate your heartbeat. This abnormality can be detected on an electrocardiogram and significantly raises the risk of dangerous ventricular arrhythmias, conditions that can lead to sudden cardiac death. Because of these risks, Tricyclic antidepressants are no longer considered the first-line treatment for depression in older adults. Modern medicine now favors newer antidepressants that are far safer for the heart. However, these older drugs are still sometimes prescribed for managing chronic nerve pain. If you or someone close to you is taking one of these medications, it is absolutely critical to consult your doctor. Ask whether safer alternatives have been explored, and ensure that both blood pressure and heart rhythm are being carefully monitored. Mental health and physical health are deeply interconnected. You must ensure that treating one does not come at the expense of the other. Now we come to number 1, the most controversial and widely debated topic on this list, but one that cannot be ignored given the growing concern within the scientific community. We're talking about calcium supplements. Yes, the very pills millions of people take daily to protect their bones from osteoporosis. For years, the message was simple and widely accepted. Take calcium to build and maintain strong bones. But in recent times, an increasing number of studies have begun to question whether these supplements are as safe for the heart as once believed. Let me share the story of Linda, a 70-year-old woman who, concerned about osteoporosis, began taking high-dose calcium supplements on her own. Years later, she suffered a heart attack despite having no typical risk factors. She didn't smoke, and her cholesterol and blood pressure levels were normal. As her medical team investigated possible causes, attention turned to her long-term supplement use. The controversy is very real, and while the scientific evidence is not yet definitive, the underlying theory is deeply concerning. Calcium obtained naturally through food sources, such as dairy products and vegetables, does not appear to pose the same risk. It is absorbed gradually and utilized efficiently by the body. The potential problem arises with the large, concentrated doses found in supplements. When you take a calcium pill, it can create an unnatural spike in calcium levels within your bloodstream. Your body cannot immediately use all of that calcium for bone health, leaving excess amounts circulating in your system. The concern is that this excess may deposit along the walls of your arteries. This process, known as arterial calcification, can stiffen blood vessels and contribute to the formation of plaques, the very plaques that can trigger heart attacks. Some large-scale studies suggest that calcium supplements may slightly increase the risk of heart attacks, while others have found no significant link. The evidence remains complex and sometimes conflicting. For individuals with diagnosed osteoporosis, the benefits of supplementation may still outweigh the risks. But the key takeaway is clear: more is not always better. The safest and most effective approach is to obtain calcium through a balanced diet. And if your doctor determines that supplementation is necessary, it should never be a decision you make on your own. It must be carefully evaluated as a medical choice, one that considers not only your bone health, but also your overall cardiovascular risk. Today we've exposed the hidden risks behind 5 of the most commonly used categories of medications: anti-inflammatories, stomach acid suppressors, decongestants, certain antidepressants, and calcium supplements. My message to you is not fear. It's not to suddenly stop your medications. That would be extremely dangerous. My message is awareness and control. You now hold critical knowledge that many people overlook or never receive. You understand that a simple arthritis pill can place dangerous strain on your heart. You realize that a medication meant to protect your stomach could be disrupting your heart's rhythm. You recognize that a routine cold remedy can carry serious cardiovascular risks. Use this awareness to take an active, informed role in your own health care. The next time you visit your doctor, don't go passively, go prepared. Bring a complete list of everything you're taking, including prescriptions, over-the-counter drugs, supplements, and vitamins. Ask direct, informed questions. Doctor, I've learned this medication may carry risks for my heart. Is it still the safest option for me? Are there better alternatives available? Should we be monitoring my blood pressure or running specific tests? Every medical treatment is a careful balance between benefit and risk, and that balance shifts as you age. Your heart has carried you through decades of life. It has endured stress, change, and time. It deserves deliberate, thoughtful protection. Safeguarding your heart is one of the most important investments you can make in your future health and longevity. Never take any medication lightly, no matter how routine or harmless it may seem. And before we end, I want to ask you one final thing. Share your thoughts and experiences in the comments. Did anything you heard today surprise you? Your story could inform and protect someone else. And always remember, the most powerful step you can take, starting today, is a simple conversation with your doctor. That single step could make all the difference in protecting your heart for the years ahead.